The COVID pandemic has caused a lot of problems for all of us. One issue we are seeing as physicians, and I'm a cardiologist on a daily basis, is that a lot of people gained a lot of weight during the pandemic. And that's explainable because of lack of exercise, lack of opportunities to go out, to play sports or to go to the gym, because the gyms have been closed. Now they are reopening, however, at limited capacity. What does it mean for us? It means that we still should exercise, and there's different forms of exercise. As a cardiologist, we always promote what we call is high intensity interval training. So, in other words, if someone does a walk an hour a day for 2 miles or so, that's a great activity, and if you don't do it, you definitely should do it, because any activity is better than no activity. On the other hand, however, if you want to train your heart, you have to be doing more than just a slow walk. What we want to do is we want to get our heart rate up, we want to get short of breath in order to keep our blood vessels elastic, because that determines basically our cardiovascular health and fitness, and we want to train our heart. In order to do that, we have to do that high intensity interval training. What does that mean? It means that we have to use exercises for a short period of time where we get our heart rate up, meaning we have to push hard to reach 85% of our maximal heart rate for a short period of time. The maximal heart rate usually is defined as 220 minus our age, and 85% would be the target for high-intensity interval training for a period of 30 to 60 seconds only. So, in other words, let's say you do a walk slowly for 5 minutes, that's fine, but then you have to sprint or push really hard, do a power walk, that you get short of breath, get your heart rate up to that 85% of the maximal heart rate, followed by a resting period of another 5 minutes, and thereafter do the same series again. A short push, high intensity, followed by a resting period. So we really don't need a gym for certain exercises, especially now. Still people are scared to go and mingle with others in a crowded place, which is correct, and we warn against that. But there are several things you and all of us can do at home, and we don't need much equipment for that. You need just a little room and maybe a chair. And there are certain exercises all of us can do, whether you're older or younger, whether you're fit or a couch potato, whether you're pregnant or not. And what it takes is basically we want to move, we want to stretch, and we want to hold. And there are certain exercises which our trainers will show you, which everybody can do at home. And the more muscle groups we move and activate, the better. And why is that better? Because number one, it increases our metabolism. Number two, by thus we burn more calories, meaning that helps with the weight loss. And number three, we increase our elasticity of the blood vessels and we train our heart. So high intensity exercises to be done at home for 15 to 30 minutes at most, 3 to 5 times a week. Everybody can do that, everybody should do that. And we challenge everybody to help us and go ahead for a better cardiovascular health.
So to start off this high intensity workout, we're going to start off with some high knees. You're going to be working for 30 seconds and then you're going to be resting for 30 seconds. You want to keep your knees up for the entire 30 seconds. Keep breathing. Okay, so our next exercise is going to be working on our upper body, our shoulders, and our core, as well as our chest muscles. It's the beginnings of a push-up. So we're going to grab our chair, and you're going to just put your hands right underneath your shoulders, your body straight out. A pop squat, so I'm going to go ahead and get that started right now. alternating lunge. So I want your feet about hip width apart, and we're just going to do one step back, keeping your upper body nice and straight.
So again, we were talking about high intensity interval training. So why are we talking about that? Because we want you to join us in our cardiovascular challenge right away. We promote high intensity interval training for cardiovascular health. We know that this is the best way to keep our blood vessels elastic, to improve our metabolism, and to condition our heart. So it's my utmost pleasure today to introduce Ashley and Terri, who are both personal coaches and trainers, and as you can see, very fit. And they will show us some simple exercises which all of us can do. We don't need a gym for that, but all of us can do simple exercises to get our heart rate up, to train our heart, to condition our whole system for 10-15 minutes a day, minimum 3 to 5 times a week. So please enjoy, and thank you again, Ashley and Terri, for helping us out and giving our viewership advice on this. Thank you.